if it's Facebook, YouTube, but we are live, and I brought on someone that I've met here, there at trade shows throughout the years, but just recently learned a lot more about your products because I am using backflow prevention. So I want to invite and thank Jim Langeloh, right? Yeah, Langeloh.
Correct.
For coming on from Dove Dental Products. So Jim, while I take us live on some other areas, I would love for you to tell us your journey, who you are, and what you do.
Sure. Awesome. So I'm based out of Naples, Florida, and my background, I have about 22 years now in dental. Started with Cavo long time ago. So everything from hand pieces to chairs, capital equipment. Moved over to Sycan, and Sycan is known for the Statum. Sycan moved me down to Florida here. I still have a lot of friends and colleagues over there. And along the journey, stumbled upon a startup company about 5.5 years ago. Loved the idea. It was developed by a dentist, and he just had a thought that infection control products are really going to be huge in the future, and in particular in the evacuation space. So that's my background, and yeah, I'd rather be out working, but this is great. Thank you for having me.
Of course. So I mean, it is very true that, infection control products are becoming kind of the it product right now in dentistry, whereas, lasers and implants, they were all super sexy and fun to talk about. But, infection control is really the foundation of a healthcare facility so that we don't make people ill while we're doing those other very cool procedures. And I didn't realize that you had worked with those other companies prior to this.
Yeah. So a lot of my colleagues are still in dental. They're everywhere. So when I mentioned to you the other day via email that someone asked me about Pelton chairs, I've got friends over there still. I've got a lot of guys that are still at Sycan, and a whole bunch of them selling cone beam right now. So once Danaher came into the picture, you saw a lot of movement.
Yeah,
with all of our teams. So. But we've always stayed true. A lot of us have stayed in the dental industry for years. So it's really good to see a lot of, old colleagues that you've run into. And they're always asking how our startup is going, because they see it more and more now. When they go in an office, they're starting to see our little blue valves. They're starting to hear about disposables more and more. So it's fun. It's exciting. And we're a small, nimble company. We're based in the U.S. So everything we make is made in the USA. And I think that's going to have a whole new meaning in the future too.
For sure. And, I came about the idea. So one of the products that you create is a backflow preventer. And we'll talk about what that actually means and why it matters. But I stumbled upon it because about 1.5 years ago, I was like, oh my gosh, we have really got to start controlling these aerosols. I think they're a bigger problem than we give attention to. Like we talk a lot about bloodborne pathogens, but we don't talk about aerosol management. And I'm a big fan. I've always done like ProfiJet way back in the day when I only had sodium bicarbonate, and now I have glycine and I have erythritol. So I'm a huge lover of airflow. But that it creates a ton of aerosols. So I was like, I'm going to have to get right with this HVAC. It's cumbersome. It's heavy. It's difficult. I never was trained to use it. And I was like, oh, I'm going to have to do this now. But then I was having such a hard time with the pooling in the back of the mouth and collecting the aerosol. So I was like, well, I'm going to have to use my low volume too. And then I read about backflow and I was like, I want to vomit. Like, that's disgusting. How do I fix that so I don't contaminate my patients? And I found backflow preventers, and then I met you guys, and you have all of that, including amalgam separators, which I'm learning a lot about as well. So can we talk about, let's see, tell me what would work better, because also I would love to talk about maintenance of our suctions, because your high volume is only going to work as well as you take care of it. Is that a kind of a true statement?
You're spot on. Yeah. So I brought a few valves here to kind of do a show and tell, but typical saliva ejector. This is how most of them are in the market. The
Mm-hmm.
newer ones don't have a rubber cup anymore. So if you see an ADEC chair or a Pelton chair, they'll actually have a full metal version of this. But
Okay.
inside here, you'll see O-rings, your little turret, which is this little lever. They
Mm-hmm.
pop out on every single one. And if you ever read an IFU or an instruction for use
So we
on
take this
these,
out.
doesn't matter who it's from, they are very lengthy and they tell you to do it every single patient. And what they tell you to do is disassemble the entire valve that includes rubber cup. They tell you to take off the O-rings. They also tell you to remove it off the line, every single patient. Some companies will use the term routinely, but it's never taught in dental school. So they always have someone there who does the maintenance for them. They'll say chair, whatever number is down, check the suction, and it's usually related to these pieces clogging, these pieces getting dirty
Mm.
where they no longer turn easily. Most people don't realize the saliva ejector and the HVE, they're designed after a handpiece. That's why they swivel. So as you know in your profession, wrist fatigue is huge. So these
Mm-hmm.
things are supposed to swivel. And any office we go to, it doesn't matter
You
who, they're
don't
not going to
swivel.
swivel. No.
They don't
And,
swivel.
and then inside here is a petri dish of all the last patients. So if you think of the current protocol,
I can pull that up.
they'll tell you to flush daily. So what that means is one patient is going to have the least amount of risk. All the rest have a tremendous amount of risk. So if patient one comes in, you flush it. Patient 2, 3, and 4, you don't flush it. Well, guess what's still in here? Blood, saliva, everything you can imagine. And
Yeah.
a lot of times it'll leak. It'll leak around the bases and you'll see a little bubble. And the reason that occurs is inside here, there's an O-ring. So
Mm.
that O-ring is designed to obviously keep fluids inside the valve. And when you don't change it, you don't clean it, or you don't do anything, and it doesn't swivel anymore, it'll bubble and then eventually leak. And where does it
Oh my
leak? Well,
God.
it usually goes right on a patient. So backflow is when a patient closes around a straw
Mm-hmm.
and the changes in the vacuum immediately go the wrong way. And so anything in that line is coming right back at that patient. And all the research that goes back 20 plus years, it's been numerous studies have been done on it. It's 1 in 4 is ultimately what it boils down to. So when you close or when you instruct your patient to close,
Mm.
you're basically telling them, 25% of the time you're going to get that last patient's junk. So it's pretty gross. And right now, all studies point to saliva ejector backflow, but they both
Show
connect
this
to the
too.
same. Yeah, that's a saliva ejector. That is taking it off and looking on the rear side. And if you look around the edges, that liquid form that leaks out the sides. So we see it in every office we go to. It's gross. It's disgusting. So what we urge people to do is if you're going to continue to use a metal valve, clean it properly, read the directions, or look at an alternative, look at a disposable version. And that's where we fit in with our products.
Okay. I'm hoping you don't hear the dozen people outside that decided to start doing construction at about the same time that we go live. I'm like,
No,
I knew they were I saw their trucks and I was like, I know they're about to do this. I think everyone is being very, showing a lot of grace to anyone that's working from home these days, though.
yeah, except my kids.
Yeah,
They were
exactly.
confused why they couldn't stay here. I said, just leave for the next 10,
You got to
15
go.
minutes.
You got to go.
Yeah.
So, yeah, and that is a thing that even those little details, like I can't, and someone on the Facebook thing said I just gagged. I know, it's so gross. But and there's a lot of maintenance that goes to dental equipment that I don't think a lot of us know. And because if you didn't get that, if you weren't taught that in school,
Correct.
then who's going to teach you? Or if you're, whoever's maintaining the equipment in your office, if they're not the ones highlighting that, then how do you know? I mean,
Yeah.
unless you're like actively like, I should read instructions for use, and no one's doing that for
No one's
funsies.
doing that.
So,
So most people don't even realize, when these show up at your office, they're usually connected to the dental chair. So
yes.
in like an ADEC pamphlet, it's going to say the assistance instrumentation, and you're going to have to dive in there and you'll see 3 pages of typical maintenance. And one is between patients, one is weekly, one is monthly. What they want you to do is, maintain it, lube it, clean it, flush it, scrub it. They're saving their butts. So if someone ever did come back and say, hey, I believe I received backflow from a particular valve, the first thing they're going to come back and say is, are you following the instructions? And I can only tell you that with exception to the VAs, most people do not follow the instructions. So every
No.
VA in the country has to. And
Okay.
about,
That makes sense being a
yeah,
government facility but I think that's it. Well, from a hygiene standpoint, our biggest complaint is that we don't have time.
yeah,
Like we don't have the time to do this. And I just saw a breakdown last week of an appointment, right? Like you have 10 minutes for health history and x-rays and this and this. And then at the very bottom was 4 minute for operatory turnaround.
yep.
And I was like, but that's not realistic if we're trying to do all the things that we should be doing, like running our water lines, cleaning our suction, taking those valves out, barrier wrapping, cleaning, letting it stay for like there's so many things.
I agree.
And so then is that why Dove Dental came up with everything just kind of clicks off and disposable?
Yeah. So a few years back, the VA in particular went out and did a study. How long does it actually take a person to follow the instructions? And and then they put a dollar value on it, and that really put us on the map overnight. So we had the product ready to go. We had a few public sector using us, but they determined just to put it into SBS, which is sterile processing in the government. But if you were to take it, remove it off, this is no different. Take it, remove it, bring it down to your sterile processing center or your center with your Statum, you got to disassemble it, scrub it, put it back together, bring it back to the chair. Usually you have to cover it. So it took 10 plus minutes per valve, and it was over $3 per valve. And it's multiple people. So in a government facility, it was 2 to 3 people. In a private practice, it could be one person, but it's not practical. It's just like a hand piece. That's why you usually have 3 hand pieces per room. So one's in the autoclave, one's ready to go, one's in your hand. And you want to have the same flow, but these are often ignored. So they're just as dirty, if not dirtier, but they get ignored.
And so can you explain backflow prevention, or just backflow, I guess?
Sure.
Like what is backflow, and how does 1 out of every 4 or 5 people get this backflow? Like what is that? Why does it matter?
Yeah, so backflow from saliva ejectors occurs when the pressure in the patient's mouth is less than the evacuator. And the things that can affect it are where you're working. So if you're working over the patient, obviously gravity will pull it down. A lot of times, if you just have it hanging off the patient, they're more apt to just close often. And the worst thing is telling your patients to close. That's a big no-no.
Yeah.
We see it still taught in today's schools. We have quite a few schools using our new products, the valves, just because they don't have time to teach it. They've realized it's an issue, and it's the same in a big school as it is in a little school. These are on, and when they stop working, unfortunately, the student is they're not the ones who clean it or fix it. So kind of where we fit in. And backflow, and the percentages, we think it's higher. So those original studies were 20 plus years old. They never looked at the HVE. And the reason why they didn't look at the HVE is obviously this is a straw and people close around it all the time. So all the studies gear towards this. However, they both work off of the exact same suction. So if you're using an HVE, this isn't a new suction in your office. This is same suction, just a bigger tube. If you close around this, you're just as likely to get it with the saliva ejector or the HVE. And then obviously, to prove my point, they both connect to the chair, they both connect to the trap, and then they go to one central vac. So we're not changing the vac. And then the other thing that'll affect it is different rooms. So if you have another patient next door, if that patient is going on and off, and you're in this room and they're closing, just changes in air pressure from room to room affect it.
Oh, I didn't think about that too. Yeah.
Yep. It's all one vacuum.
And the lips around the suction, it's not even like, and I've been doing this 20 years. When talking about training an old dog new tricks, like that's really hard. And we've also trained our patients. So even when you're not like, you're like on the way out, they're trying to like close. And so even retraining them is hard to like, don't close on this. And then having to have that conversation, which is also, you don't want to like scare them at the same
Yep.
time. So having something that would just prevent the problem would be ideal, I would think.
You're correct. So that's where we fit in. We're not the
Ah,
only player in town, but we're the only one that does the entire valve itself. So there's
mhm.
disposable straws that you'll see out there, or saliva ejectors. But our product, we have two in this category. So originally we came out with the little blue saliva ejector. They're
Mhm.
disposable. We take that exact same line that you have, we remove your current valve, and then we pop right in. We use your exact same connector. We still swivel. We still have an on and an off. But inside here, there's a backflow flipper.
Mhm.
So anytime my patient closes, it immediately prevents backflow from occurring. And then our
Right.
newest product that just came out. So if you think of issues in this market with traditional saliva ejectors, I bet you a lot of your people online, they've thrown away this rubber cup or it's
Yeah.
fallen loose, and that seems to be an issue. Our little straw, the further you push it in, the tighter it gets. However, we came out with a new one that has it all in one. So we
Mm.
secured the straw to the valve, and now I can close safely and nothing's going to go the wrong way. And it's single
Mm.
use, so I don't have to worry about cleaning it. We've dropped the price, so we've gotten it down half that cost of what I told you earlier. So
Nice.
we're about a buck 69, and then we're throwing in 100 more free, so it actually brings it to about 80 some cents per straw. So you're saving time, you're guaranteeing it's clean, you're removing backflow, you're alleviating a loose straw from coming out during a procedure.
Yeah.
So it's been a great product. And then during this coronavirus issue that we're having, we launched 25 free for any office in the country.
Nice.
So yeah, we
How
created a
do the
program.
people, I'll put that info up here. How do they get that?
Yep, just shoot us an email with your office address. So sales@dovedentalproducts.com. And so far, we've sent out quite a few of them. It was on two programs last week, and we just announced this like a week and a half ago. So we've announced it through Shine, Patterson, Benco. Those are our suppliers, and we'll send you 25 of these free. There's no obligation whatsoever. It's
Nice.
our response of trying to get a safer product out there for emergency visits. It'll fit
Mhm.
on any North American dental chair. Use it, dispose of it, and just provide a safer visit for every patient.
Yeah, and I think, this is just speculation, but I think that after this, we're going to see a lot more single-use products in dentistry, which I love, but also hurts my hippie heart just a little bit to reuse it. But it's still, I mean, it matters that we
Yep,
don't make people sick.
I
Um,
completely agree.
so I'm also curious. All right, so can I talk about some other things as far as the
Sure.
suction? Like, if I have the high volume and low volume going,
Mhm.
is that an issue?
Um, with regards to what?
The backflow or
Of
losing,
course.
yeah.
Yes. Yeah.
So
So
it's
changes in
not
air
just
pressure
the
can
low
be done
volume
by,
going, it's when you
yeah.
start adding both to it as well.
Yeah, and you notice your vacuum power
It decreases a
probably,
lot.
yeah, decreases depending on what type of vac you have, and especially if
Mhm.
you have more patients in the office that day. But sure, the more you turn it on and off, the more it affects the other one, and obviously gravity. But closing, there's a whole slew of issues, and there's no way to prove it. So that's the big issue right now. We know what happens. We know it happens basically 1 in 4 patients, but how are you going to prove it other than going in and doing a specific backflow test on that line with everything, going on in that
Mm.
office, on and offs, and um, there's countless research out there. And then the CDC gives very clear guidelines as well. Don't ever instruct your patients to close around.
Good too.
Yeah, so that's a gross picture. So
Yeah, that's a real
that
special
is,
one. I'm not sure if it's
yeah.
lunchtime
So a
yet
lot of
for
us,
anyone, but
they're gross. So when your chair is and your valve is just sitting here and you have no patient and your line kind of droops on the floor, that's the middle pitcher. So what happens is all the fluids, they don't
Mm,
continually suck, obviously. So when you turn it off, they settle and they drain
yeah.
down. And then when you turn it on, you'll hear that sucking sound, and that's that gurgle of that nasty stuff in the middle. And then on the right, that's actually a chair line that was flushed. So we all think it's squeaky clean in there. It's not. They're going to be
Mhm.
gross. There's not, it's like Drano. It's not someone in
Yeah.
there scrubbing the insides. And then on the one on the left is nothing different than just showing the inside of a valve that was deemed clean by the
Mm.
staff. And all we do is just walk in and say, look
Click it off.
inside. So it's every office we go to, unfortunately. Sometimes it's a little drier, but yeah, we have countless pictures. If your friends out there want some
If
more
anyone
pictures.
wants some pictures, you should definitely. I've always wanted to do. There was a show that used to be on Bravo TV because, as much as like a science reader I am, to
Yeah.
shut my brain off, I watch trash television, and it's a guilty pleasure of mine. And one of my shows was Tabitha's Takeover, where she was a hairdresser, and she'd go in and she'd like shake it up and show people like how their business stuff wasn't great and their education wasn't great, but
Yeah.
then she'd like take a white glove and just like take it around and like show how
Nasty.
dirty things were. I've always
Yes.
wanted to do.
Yeah, no,
Pull
I'm
everything
with you
else
on
off.
that.
Like, you call this clean?
Yeah, I can't stand going to the dentist. I'm the first one because of my CAVO background and SciCan. I've seen too much. I know there's some
Too
great
much.
dentists and there's some great hygiene and
Yeah.
assistants, but I have just usually when we were called in, it's because they didn't clean something correctly, something broke, and it's usually breaking because it wasn't cleaned correctly.
It wasn't clean
So
correctly. Yeah.
yeah, usually is the
So can we
likely
move and
cause.
talk then about like what should we be doing for our suction lines?
Sure, sure. So if you think of your HVEs, I understand time is of the essence, but I think we all can agree just simply wiping might not be enough come, the next few
Yeah, let's
months.
hope not, right?
Yeah, I think it's going to get a lot of scrutiny. So,
Mhm.
between patients, if you're just wiping this down, I would urge you to at least try to run a cleaner through it. I
Mhm.
understand time is of the essence. Obviously, I want to see you use my products, but if you can increase that infection control protocol between patients where the most risk occurs, that would be great. And then, obviously, try to routinely take these off and clean them. And you're going to get a better performance out of it. It's going to last longer. Your O-rings aren't going to fall apart as quick. You're still going to get a swivel. It's going to perform like it should. And the same goes for the little saliva ejectors. Try to routinely clean these things. I've heard countless assistants, hygienists say, I don't let so-and-so use my valves because they don't know how to clean them. And on the same token, I can walk in there and they probably don't disassemble them either, but they're a little more diligent. And
Mhm.
then if you have an office that's willing to increase infection control, we obviously make a category of full disposable products. So on the HVE side, we make valves that snap right on. So we
Mhm.
make them in short valves, and then we make them in long valves. So any evacuation product out there, we make it. And then for hygiene, we actually make them in purple if you're interested. So
Oh, the color of hygiene. We appreciate that,
that's right.
love.
Yeah.
That's
So
great.
if they could do anything, clean them a little more,
Mhm.
disassemble them, you'll see the issues that we see every single day, especially down in here when you remove the valve. That
Yeah.
portion is just a petri dish because it never gets removed. And that's where so much of the junk builds up. And then kind of a tip, take Vaseline, lubricate that O-ring if you can to give
Mhm.
it a little more life to it because they get
Yeah.
dried out because of all the cleaners that go through it.
Right.
And
Yeah.
when they get dry, they get brittle. So just a little bit more
Mm.
care. If not, step it up to disposables. I'll make
Mhm.
it affordable for you. We do BOGOs all the time. Our goal is to obviously give you a safer visit. And we're
Yeah.
members of OSAP. We think that's huge. We think that's going to
Big
be a
fan.
real big thing in the future. The safest dental visit is really what they're trying to promote by getting offices actually following certain protocol in the future for safety. So we're excited about that.
No kidding. Yeah. So I'm curious. I know that's not like in your product line or anything, but when is there a way for me to prevent that stuff settling down in the line? Or is that just the nature of the beast of the
It's
cord?
nature of the beast, but flushing the lines.
Okay.
So the other risk, though, is if you don't use, and you'll see that on the CDC guidelines, if you do not use a backflow preventer, um, often patients will get a mouthful of cleaner. So when they
Oh.
close around the straw, the cleaner goes the wrong way. So it's kind of a double-edged sword, clean between patients, um, but unfortunately, unless you're using a backflow preventer,
Mhm.
you're always at risk, always. So Certain gurus out there like the Pat Pines of the world will tell you if you didn't scrub it and you didn't disassemble it and you didn't reprocess it, it's not clean, which we know is true.
Yeah.
So basically, if you run it through an autoclave and you don't scrub it, clean it, you're just basically caking all that junk on.
On it.
So
Yeah. So, but
there are inline. Go ahead.
when I pull that part off,
Mm-hmm.
doesn't that just leave my suction on? Won't I hear it until I replace it with a new one?
Yes.
Right. Yeah. So I'm going to have, if I don't have the reusable ones, I'm going to have multiple of those, right? So that it doesn't drive me bonkers crazy with that white.
Yeah. Or you shut off your chair. So, even if you had 2 per room, it's not a huge investment. I mean, to buy 2 of these things is probably $40-$50.
Mm-hmm.
They're not outrageous. The other product we make, which we do really well with in the government side, are plugs. So when you remove it, we plug the lines.
That's nice. Okay. So when you're popping it off, you're putting that plug on.
Yeah.
And it's reusable.
So on the we urge you to dispose of them. Obviously, it's going into that gross area, but we have, again, it's not going in the patient's mouth. These, they're rubber, just like an O-ring. They fit in both lines, so it'll fit into, it's called a duo tail cap. So it'll fit into my saliva ejector. It'll fit in my HVE, the same piece.
Got it.
Sorry, I had a phone call there. The government removes the valves, which are our valves, and then they pop these on because if you ever went into like a military facility, the chairs are so discolored because they clean the daylights out of these things between patients. So that's what one option. Or we've seen people use cotton balls, and cotton balls get stuck up in there. So
I was gonna say that just is looking for a clog. I feel like, and then so those little caps. I know everyone would ask, are they autoclavable or are they just, you're going to have to dispose of them?
Yeah, they're designed to be disposable. So we sell them in bags of 150 or 600 in the case. And, if your group out there wants to try them, I'll send them a handful and could you reuse them? Yeah, they're just little plugs and they're designed to fit in. This one's an ADEC one and a traditional Saliva Ejector one. We have a new one that'll fit any chair coming out. So it's just it's another step in infection control. The easiest way is patient A comes in though, and you put on your disposable one, throw it away, wipe down the tubing and put on a new one. And we know it's guaranteed every single time.
Which seems like the smarter way. So one of the questions that we just got from Marie, does spraying cavi wipe, I guess cavicide too, in and around the HVE and saliva ejector help more along with wiping with a cavi wipe? We were told in an ortho office that it wasn't necessary to spray before wiping and that wiping with the cavi. Well, I mean, that's, I guess, going back to like, are you spray, or you wipe, which I think is being changed to just clean and disinfect because it looks different for everyone. But
yeah, there's a lot of studies out there that talk about that.
Okay.
They talk about the buildup that occurs when you just continuously wipe, and you don't do anything between. It almost becomes irrelevant. So there's a good study out there from Pat Pine in 2007 on surfaces. She studied, I think, 200 surfaces of HVE valves that were deemed clean, that were wiped only. And she went in with, I forget the little tester that she used. It's like a swab test on the exterior. And 99% of them failed. They all failed the cleaning test of was it clean or not. And no, none of them were clean. No.
Which is interesting because, I've been really pushing making sure that you're barrier wrapping your HVE and air water syringe because they are so cumbersome to clean, and I'm fussing with them trying to get into all the nooks. And wouldn't it just be better to like call it a day?
Yeah, barrier wrapping is great.
Yeah. Let's see. Someone just asked, Jen asked, oh, hello, Jen. Would you sell directly to the clinician or do you have to go through a dental dealer?
So we urge you to go through the dealers because they're all stocked. So Shine, Patterson, Benco, Dental Health Products. In the South, we have Nashville Dental and Atlanta Dental soon. So we have most of the market covered with those. And for the direct sales, we usually just stick with the public sector just because they buy in bigger volume. So all the stuff we carry in-house are huge cases, cases of 600. These little guys are cases of 1,000. where in the distribution channels, we sell them in smaller packages.
Yeah, and Jeanette said, I can vouch the VA uses the product besides making life easier, it gives you peace of mind that you don't have to worry about backflow. 100%
Nice.
agree with that. And I mean, just again, like the fussing of it, like, isn't it just easier for me to, instead of flipping, because I'm always like flipping the switch up, getting around it, flipping it back
Yeah.
down, getting around it again. And I'm just like, toss it away and call it a day. Wouldn't that be
Yeah,
nice?
I agree. And
Yeah.
I think your patients might have a new reaction when you show them something that looks pretty aseptic, looks pretty clean, it looks a little more medical. Patients are going to be a little more aware when they start coming back into the offices, whether it's July, August, or in the fall, when they
Who
start to get a
knows?
little more
Yeah.
comfortable. They're going to ask, what are you doing differently? We've heard it, I can tell you, in my neighborhood right now. These
Oh,
moms that are sitting at home that are wiping everything off with gloves and masks, they're becoming educated. They're learning about what are the risks. And when they just walk into the hospital, trust me, they're going to ask the same thing when they go into the dentist's office. What are you doing differently that you didn't do 2 months ago? And this is a really nice way to show them that obviously this is the grossest part in the dental office, which
mm,
is your suction. It takes all the junk out of the office and reinforces safety
yeah.
right at the chair side.
I was wondering, and I posted this the other day because I feel like because I'm so far away from my vac, like I'm the last office away from the evacuation or the vacuum closet, that I get less suction. Is that you think
Yeah,
that's yeah?
certainly. Yeah,
Yeah.
distance traveled will certainly affect it. The twists, the turns, depending on when your office was built. So if, depends on where you're at. If you're in New York, it might go above your head, which is crazy because they have limited
Yeah.
space. And, traditional older offices, they may have some weird twists and turns underneath the building or in the basement on how that suction is getting from point A to B. And then where are they all meeting? So there
Hmm.
could be a backup somewhere in there. That's why service techs, that's why we really urge going through distribution, because a lot of times people will buy these and they'll go, that didn't solve the suction issue. And it helps when you have a Shine or a Patterson or a Benco in your backyard where they can come in and go, yeah, of course, because this tubing is now shot. And
Mm,
it's hard for us to do that one-on-one when, we're a small
that makes
business.
sense.
We're good at manufacturing it, but I'd love to go to their office, but I can't be everywhere.
Right. So you also have amalgam separators
We do.
that are suction unit device. What would you how do you describe that?
Sure. So about a year ago, we went to a trade show, OSEP it
Mm-hmm.
was, and one of the gentlemen came out with a product that we looked at, we studied, we did some research. We looked at the category of amalgam separators, and for those who are probably aware by now, every dental office in the US, with a few exceptions, needs an amalgam separator by July.
Mm-hmm.
And it's been a 3-year crawl process where people are kicking and screaming because people don't want to do it. B, it's, they're adding something that's going to cost them money. It's going to require maintenance. And then C, it's kind of nasty. So
Yeah.
we jumped into this category because it fit really well. The company that we acquired is called Capdol. And Capdol is a chairside amalgam separator. So traditional amalgam separators are in the back room. So take our last conversation, all that suction goes flowing in to the amalgam separator, whether it's saliva ejector, HVE, and all that stuff, including blood, saliva, debris, and
Yeah.
amalgam, go
Yeah.
into a separator, and eventually the amalgam settles and it captures it over time. Traditional amalgam separators collect every 6 months. You got to change it. Sometimes they're a year, sometimes it's 2 years. Capdol has a new approach, and we think amalgam's dangerous. We think it's nasty. We don't want it in the chair lines. So they're individually wrapped. They fit into any HVE. I'll show it on our HVE. It's
Mm-hmm.
designed to be used on a patient, not another patient. So one per patient. This will collect 95.4% of amalgam when removed using an HVE. Okay. Once it's full or once your procedure is done, you recycle it. Okay. So it goes immediately from here, never gets into my line, never gets into my chairside trap, which,
Right.
if you look at all the studies, 68% of amalgam goes to the chairside trap. it never makes its way to the amalgam separator. That gets the remaining 30+%. So the new rules and regulations specifically tell you, collect your amalgam from the separator, go back into each room, clean out every chairside trap. Here, we alleviate the whole problem. Yeah, so we don't need installation. It's $7 a straw. It's sold in a box like this, comes with the recycling. Everything is included, but it's really about complying to the new EPA requirement safely. We think there's nothing safer than this right here, because it never gets into any of those places where it's going to sit, and then it eventually turns into a gas, which, you know, that's the big scare. Amalgam, mercury, turns into a gas sitting next to the patient. What does that mean when a patient has a chairside trap full of amalgam sitting next to them and it's been there for weeks? So that's the big fear, and we think Captol is a nice fit.
Nice. And yeah, and let's clarify recycling and the proper amalgam waste receptor, not your recycling bin, y'all. Like, don't be putting it in the blue bins in your office.
No.
There's
it comes with one, so
place, and that's good. That's great. There's some people that were like, oh, I recycled it. I'm like, no.
Yeah, no. So it comes with a recycling box, and it has a plastic liner. So it's kind of like a milk jug inside. You unscrew it, put these in, seal them back up, but get it off site immediately. We sell them in smaller packages because the average dentist is doing about 20 to 30 amalgam removals, and that number keeps drastically reducing every year. So think of a pedo office. They might do 1 a month, 2 a month. These don't expire, doesn't take up any space, and it's compliant. There's a equivalent device category that the EPA revisited in 2017. So we fit really nicely in there. We can be sold in, I think it's 47 states. There's 3 that are still using the old amalgam rule, and but the other 47 jumped on board, and it's a great little product. It's $7 a tip. That includes your recycling. It's safer in this day and age. You can't say that enough to the dental office team, and you don't have to worry about cleaning out the sludge. Really is the term that people use on traditional amalgam separators is, blood, saliva, amalgam turns into a mud sludge, and then someone's got to put on a hazmat suit and go clean it. And OSHA says respirator, goggles, utility gloves.
Where's Mike Rowe for that dirty job?
That's right.
We need him back.
So,
and you're right. Like, not everyone's removing amalgam. And what I didn't realize is that a lot of prophy paste actually ends up in those amalgam separators and kind of fills it up before you even get to amalgam that was filling it up. Is that right? Yeah.
You are 100% correct. So the prophy paste has a similar dense weight to the amalgam that you're removing. So when you go to change that amalgam separator in the back room, it's full. It's full of prophy paste. So you're changing it more frequently. Some of them have filters. Those filters need to be changed anywhere from 2 to 6 months. It can be aggravating, frustrating. Again, this is no maintenance. So is it for every office? It's great for the offices that are not doing huge production of amalgam removals. So, if you're 2 docs, 3 docs, but you don't do a ton of removals, you don't want to invest in a system that you're not going to see much, return out of it. This is a nice fit.
Yeah, for sure. And I keep joking that these offices that specialized in mercury removal and they had all the hazmat suit, they're going to be the ones that survive this whole thing.
You're right. Yeah, they have everything sitting ready to go.
They have all the infection control standards in place.
You're right.
They're going to be the real champions. We used to make fun of them, but this is where they're going to shine, and we're going to be like, tell us about that thing that you use.
You're right.
Oh, this is their time. So one of the questions that I just got, which Jessica, once this is done, you'll be able to rewatch this whole live again. So anybody who is just jumping on, don't worry. This will stay on our feed and you'll be able to see it and share it and do whatever you want with it. But one of the questions was, do you sell a backflow preventer that adapts to my existing saliva ejector line? And
we do. Yeah. So our little valves, which we talked about earlier, they're available in just the valve only, or the valve with the straw, which is our newest product. Can I show a competitor product to just give a comparison?
So I'm good. And one other one on the market too was, and these are disposable, Jessica. They are not autoclavable, because that was one of her questions.
Yeah. So we'll show this one. This is SafeFlow. And
Mm-hmm.
SafeFlow it's a cool little product.
And I've used both. Yeah.
Yeah, cool little product. And SafeFlow originally came out quite a while ago, and it's got this the big bubble in the middle that is their backflow preventer. Good product. And but you still need to use the valve. So you still got to clean the valve. You still have the rubber cups usually. You still have your ons and offs. Ours removes all of that. So ours does everything that does, but we remove the valve. So there's no more
Mm-hmm.
valve. Ours is built in. We have the on and off. We have a secured straw that you're more accustomed to using. So it's a different version, different way of looking at it. And we continue to reduce the price. We continue to make them in the US. We're confident this in schools, we're seeing growth pretty tremendous just because it's safer and it removes a huge problem with backflow. So we think this is the future, whether it
Mm-hmm.
looks like this, but we think this is really where it's geared
Something to
towards.
worry
Not,
about. Yeah.
yep, it
And then
alleviates that valve, which can be a nuisance.
And I hope the one of the changes that we do see after we come back is the time allotted for room turnover
Yeah,
so that you can flush your lines, so you can dispose of things properly. You can do your water line safety as well so that you're running, your lines between
yeah.
patients and you can tackle all of this because currently that's not the case. I'm already struggling to go to the bathroom in a day, let alone like do all of the scrubby run lines kind of thing. But it's all super important and we need to give it the time that it deserves.
I agree. I agree. And that's why I sent you those questions, 5
Mm-hmm.
questions with the infection control gurus. And we've got about 12 responses so far from the industry leaders that are out there speaking about it. And they all are kind of echoing the same thing. They want to see more time in infection control,
Yeah.
maybe more disposables, just a bigger emphasis placed on patient safety because you can't go backwards. We see at every trade show, people walk in and they run over to a new cone beam. They'll spend 6 figures, finance the house, don't know how to use it. And then they get back to the office and the doctor wouldn't spend, 80 cents more on a new saliva ejector. And, it's something that's more of the wow factor, I think it's going to take a little back seat for a little while just based on what we're
Mm-hmm.
seeing. And the next meeting that we're excited about is not till the fall. They're all getting canceled right now.
Yep.
So the ADA dental meeting, in our
Mm-hmm.
view, and we've talked to other companies, we think infection control is going to be huge at that meeting by that time.
I hope so. Even Amanda said, you're so right. It's hard to find the time to do it all. And, I, it all kind and I actually just posted my article I wrote months ago about
I saw it.
highlighting infection control and using it as a marketing point, like
Yeah,
market to your patients that you do everything to keep them super safe. And now I really think that that's going to be a part of it. Like, this is how I'm going to communicate my office's approach and protocols to making sure you don't get sick while you're in the dental chair.
yeah,
And also keeping your team safe as well. Like, how can I keep them from getting whatever you might have brought in? And you never
yeah.
know. But I think it is going to change. But I think where it came to, and this is just my personal opinion, I'm open to anyone else's thoughts on this because I think when you looked at cone beam or you looked at lasers, you could charge for that.
Yeah.
And your saliva ejector is like, well, who's getting that? I got to do that now. Now it's like $20 to turn the room down
Yeah,
around. And I get the argument, but
of
at the
course.
same time, like that, I mean, that should have always been a factor into your like infection control should be the foundation. Like, how about start there with your price and then
Yeah,
build on that?
yeah.
But
You can't risk, especially what we're seeing right now, safety, whether it's here or a handpiece, autoclaving the motors. It's going to be really in the highlight of every dental office, and you're going to be able to advertise that in the future.
I hope so.
That's something OSAP touched on years ago, but it never
Yeah.
took off, and now they're finally revisiting it. The safest dental office is they actually want to reward offices that are doing certain things. So you'll have a plaque, you'll be able to advertise it, and
Mhm.
I think it's going to be huge in the future because this is not going to be the first time we see something like coronavirus. There's going to be another something in a year or two that we're going to have to address, and might as well take the steps now especially now with the time available to go learn more infection control courses, techniques, possible products out there. Now's a great time for that. And we're seeing that, you're seeing it, people are going to all sorts of courses right now. So, which is great. And that's really what we need to do, because when we do open, like we mentioned earlier, patients likely are going to want to see a change in the office they went to. And some of the article people have been writing, you're going to walk in, you're going to take their temperature before they even get into the office. You may have a protective gown on the patient in the initial stages when they sit down. And obviously, as a hygienist, or you're going to be really, garbed up with face shield now.
For it.
That's a
Put it on me.
requirement, I think, from the ADA through the coronavirus. So
yeah,
it'll be interesting to see how this goes. But at the end of the day, we make a disposable option.
Yeah,
I agree.
I welcome it. So I really appreciate you coming on and taking the time today to, teach me and teach the audience, teach anyone that jumped on about this, because I don't think it's something that we talk about very much at all. And I think the industry is going to change, and I think we're going to have to really reevaluate our suctions, because we need it to pull those aerosols out of the air. We're going to need it to grab that spatter and spray before it reaches our PPE or the patient. And that's what I always thought was interesting. The studies where they put the auger plates everywhere, like the one that got it all was the patient's chest. And then we have patients just like rip their bib off and throw it away. And we're like, okay, well, like now they're touching our pin. So it's like really time to evaluate.
Yeah. When I started with Cavo, we had a study done. It was in Germany, and obviously high speeds, they go 300 plus thousand RPMs. When you leave that dental chair as a patient and as the person using that drill, it covers 6 feet circumference from the head of the burr. So 6 feet around is contaminated. So when you leave the chair, your shoes, your pants, everything is covered. If Saliva read that video that came out with OSAP. Yeah, and I know they're readdressing it to try and make it a little more up to date. But if you watch that, I mean, both patient and, dental professional are covered by the time a simple visit is done. So I agree. It's time to address it. And I'm excited about it. So,
and, and the argument too with it is like, it's not all an issue. Like, it's not all a problem. It's not all bioaerosols. And it's true. It's not all, this insidious like thing that's going to get us at the end, but also gross, like gross.
There's a gross factor.
I welcome no one to spit on me in any point in my life. So I'm real good not getting it even. I want to be covered.
Nice. I agree.
And Jen said, not a glamorous subject, but extremely important. Thanks for doing this. Thank you, Jen, for jumping on. Thank everyone for taking the time to watch this now and also later. You can share this from A Tale of Two Hygienists Facebook page. If you're joining me on my personal page on the watch party, you can find this entire thing on A Tale of Two Hygienists in that news feed, and definitely check out. And the website is dovedentalproducts.com.
Correct. And we'll have a brand new website. I think it's going live on Friday, and we have our old traditional one up right now, but the new one's going to have a ton of new information on it, and look for that in the next 48 hours that we launched.
I'm just going to put that on the screen so everyone can see it too, but dovedentalproducts.com, because I can't spell to save my life. So make sure that's okay. I write, but with an editor. Thank God.
Excellent.
So how about for you, is there any contact information that you want to give, or is dovedentalproducts.com the best?
Yeah. So our main email address at the company is sales@dovedentalproducts.com. And then if anyone wants to call us, it is 1-855-800-DOVE. So 855-800-DOVE. And
Nice.
Dove was actually created. It was disposable oral valve evacuation. So that's how the company started.
Cute. So, and then you got a dove as your mascot, and that's perfect.
Yep, exactly.
Awesome. Well, everyone's saying thank you very much. Thanks for all the information. I do appreciate it so much.
Thank you.
And we look forward to seeing Dove or any kind of backflow preventer, but this one would just make sense because it's all one in all offices.
Awesome. Thank you so much.
Yeah, obviously. Bye, guys.